Chapter 43, Sleep. Proper rest and sleep are as important to health as good nutrition and adequate exercise. Physical and emotional health depends on the ability to fulfill these basic human needs. Individuals need different amounts of sleep and rest. Without proper amounts, the ability to concentrate, make judgments, and participate in daily activities decreases, and irritability increases. Identifying and treating patients' sleep pattern disturbances are important goals. To help patients, you need to understand the nature of sleep, the factors influencing it, and patients' sleep habits. Sleep provides healing and restoration. Some patients have pre-existing sleep disturbances, whereas other patients develop sleep problems as a result of an illness or hospitalization. Physiology of sleep. People experience cyclical rhythms as part of their everyday lives. The most familiar rhythm is the 24-hour, day-night cycle known as the diurnal or circadian rhythm. The suprachiasmatic nucleus nerve cells in the hypothalamus control the rhythm of the sleep-wake cycle, and coordinate this cycle with other circadian rhythms. Circadian rhythms influence the pattern of major biological and behavioral functions. The predictable changing of body temperature, heart rate, blood pressure, hormone secretion, sensory acuity, and mood depend on the maintenance of the 24-hour circadian cycle. All persons have biological clocks that synchronize their sleep cycles. This explains why some people fall asleep at 8 p.m., whereas others go to bed at midnight or early in the morning. Different people also function best at different times of the day. Failure to maintain an individual's usual sleep-wake cycle negatively influences the patient's overall health. Sleep is associated with changes in the peripheral nervous, endocrine, cardiovascular, respiratory, and muscular systems. Specific physiological responses and patterns of brain activity identify each sequence. Instruments such as the electroencephalogram, which measures electrical activity in the cerebral cortex, the electromyogram, which measures muscle tone, and the electroculogram, which measures eye movements, provide information about some structural physiological aspects of sleep. The major sleep center in the body is the hypothalamus. It secretes epocretins that promote wakefulness and rapid eye movement sleep. Prostaglandin D2, L-tryptophan, and growth factors all control sleep. Researchers believe that the ascending reticular activating system, or RAS, located in the upper brainstem contains special cells that maintain alertness and wakefulness. The RAS receives visual, auditory, pain, and tactile sensory stimuli. Activity from the cerebral cortex, such as emotions or thought processes, also stimulates the RAS. Arousal, wakefulness, and maintenance of consciousness result from neurons in the RAS that release catecholamines, such as norepinephrine. Both the homeostatic process, or process S, which primarily regulates the length and depth of sleep, and the circadian rhythm, or process C, which influences the internal organization of sleep, timing and duration of sleep-wake cycles, operate simultaneously to regulate sleep and wakefulness. Time of wake-up is defined by the intersection of process S and process C. Case study: Walter Murphy is 82 years old, and has resided in the local nursing home for the past 3 months. His wife, Mary, still lives at home, but visits Walter on a daily basis. Walter is confined to a wheelchair as a result of osteoarthritis and a mild stroke he experienced 1 year ago. Even though he has physical limitations, he is alert and oriented. Over the past several weeks, Mary found her husband to be very sleepy when visiting him just before lunchtime. Walter tells Mary that he has trouble falling asleep at night, and once he does fall asleep, he reawakens frequently during the night. Mary is concerned because her husband does not seem alert or interested during her visit. What concerns should the nurse have about Mr. Murphy? Stages of adult sleep cycle. The normal sleep pattern for an adult begins with a pre-sleep period, during which the person is aware only of a gradually developing sleepiness. This period normally lasts 10 to 30 minutes. However, if a person has difficulty falling asleep, it lasts an hour or more. Once asleep, the person usually passes through 4 or 5 complete sleep cycles per night, each consisting of 4 stages of non-rapid eye movement, or non-REM sleep, and a period of rapid eye movement, or REM sleep. A person usually reaches REM sleep about 90 minutes into the sleep cycle. 75 to 80% of sleep time is spent in non-REM sleep. With each successive cycle, stages 3 and 4 shorten, and the period of REM lengthens. REM sleep lasts up to 60 minutes during the last sleep cycle. Not all people progress consistently through the stages of sleep. Sleep becomes more fragmented with aging, and a person spends more time in lighter stages. Shown as Figure 43-2, Stages of Adult Sleep Cycle. Please review Box 43-1, Stages of the Sleep Cycle, as a supplement to this PowerPoint. Function of sleep. Although it contributes to physiological and psychological restoration, the primary function of sleep is unclear. Non-REM sleep contributes to body tissue restoration. During this time, biological functions slow down. For example, during sleep, the heart rate falls to 60 beats per minute or less, which benefits cardiac function. Other biological functions that are decreased during sleep are respirations, blood pressure, and muscle tone. The body needs sleep to routinely restore biological processes. During deep slow-wave, non-REM stage 4 sleep, the body releases human growth hormone for the repair and renewal of epithelial and specialized cells such as brain cells, protein synthesis and cell division for renewal of tissues such as the skin, bone marrow, gastric mucosa, or brain occur during rest and sleep. Non-REM sleep is especially important in children, who experience more of stage 4 sleep. Another theory about the purpose of sleep is that the body conserves energy during sleep. The skeletal muscles relax progressively, and the absence of muscular contraction preserves chemical energy for cellular processes. Lowering of the basal metabolic rate further conserves body energy supply. REM sleep is necessary for brain tissue restoration and appears to be important for cognitive restoration and memory. A loss of REM sleep leads to feelings of confusion and suspicion. Although dreams occur during both non-REM and REM sleep, the dreams of REM sleep are more vivid and elaborate, and some believe that they are functionally important to learning, memory processing, and adaptation to stress. The ability to describe a dream and interpret its significance sometimes helps resolve personal concerns or fears. Another theory suggests that dreams erase certain fantasies or nonsensical memories. Physical illness can cause pain, physical discomfort, anxiety, depression, and sleep disturbances. Respiratory disease, such as chronic obstructive pulmonary disease or COPD, emphysema, asthma, allergies, or the common cold often interferes with sleep. Connections between heart disease, sleep, and sleep disorders exist. Sleep-related breathing disorders are linked to increased incidence of nocturnal angina, increased heart rate, electrocardiogram changes, high blood pressure, and risk of heart diseases and stroke. Nocturia disrupts the sleep cycle. Restless leg syndrome, or RLS, can occur before sleep onset. RLS symptoms include recurrent, rhythmical movements of the feet and legs. Patients feel an itching sensation deep in the muscles. Relief comes only from moving the legs, which prevents relaxation and subsequent sleep. Sleep disorders are conditions that, if untreated, generally cause disturbed nighttime sleep that results in one of three problems: insomnia, abnormal movements or sensation during sleep or when awakening at night, or excessive daytime sleepiness. Many adults in the United States have significant sleep problems from inadequacies in either the quantity or quality of their nighttime sleep, and experience hypersomnolence on a daily basis. The American Academy of Sleep Medicine developed the International Classification of Sleep Disorders version 2, which classifies sleep disorders into 8 major categories. Individuals with sleep-related breathing disorders have changes in respirations during sleep. Hypersomnias are sleep disturbances that result in daytime sleepiness and are not caused by disturbed sleep or alterations in circadian rhythms. The circadian rhythm sleep disorders are caused by a misalignment between the timing of sleep and individual desires or the societal norm. The parasomnias are undesirable behaviors that occur usually during sleep. Sleep and wake disturbances are associated with many medical and psychiatric sleep disorders. In sleep-related movement disorders, the person experiences simple stereotyped movements that disturb sleep. The category of isolated symptoms, apparently normal variants, and unresolved issues include sleep-related symptoms that fall between normal and abnormal sleep. The other sleep disorders category contains sleep problems that do not fit into other categories. A polysomnogram involves the use of EEG, EMG, and EOG to monitor stages of sleep and wakefulness during nighttime sleep. The multiple sleep latency test provides objective information about sleepiness and selected aspects of sleep structure by measuring eye movements, muscle tone changes, and brain electrical activity during at least 4 napping opportunities spread throughout the day. Please review Box 43-2, Classification of Select Sleep Disorders, as a supplement to this PowerPoint. Sleep disorders. Insomnia, the most common sleep disorder, is a symptom patients experience when they chronically have difficulty falling asleep. Sleep apnea is a disorder characterized by lack of airflow through the nose and mouth for periods of 10 seconds or longer during sleep. 3 types of sleep apnea are known: 1. Central, 2. Obstructive, and 3. Mixed. The most common form is obstructive. Obstructive sleep apnea, or OSA, has 2 major risk factors: obesity and hypertension. OSA occurs when muscles or structures of the oral cavity or throat relax during sleep. The upper airway becomes partially or completely blocked, diminishing nasal airflow, called hyponia, or stopping it, known as apnea, for as long as 30 seconds. Excessive daytime sleepiness is the most common complaint. Feelings of sleepiness are usually most intense on awakening, right before going to sleep, and about 12 hours after the mid-sleep period. OSA causes a serious decline in arterial oxygen saturation level. Central sleep apnea, or CSA, involves dysfunction in the respiratory control center of the brain. The impulse to breathe fails temporarily, and nasal airflow and chest wall movement cease. The oxygen saturation of the blood falls. The condition is common in patients with brainstem injury, muscular dystrophy, and encephalitis. Less than 10% of sleep apnea is predominantly central in origin. People with CSA tend to awaken during sleep and therefore complain of insomnia and excessive daytime sleepiness. Mild and intermittent snoring is also present. Treatment includes therapy for underlying cardiac or respiratory complications and emotional problems that occur as a result of the symptoms of this disorder. Narcolepsy is a dysfunction of mechanisms that regulate the sleep and waking states. During the day, a person suddenly feels an overwhelming wave of sleepiness and falls asleep, and REM sleep occurs within 15 minutes of falling asleep. Cataplexy, or sudden muscle weakness during intense emotions such as anger, sadness, or laughter, occurs at any time during the day. Sleep paralysis is another symptom. Sleep deprivation is a problem many patients experience as a result of dysomnia. Causes include fever, difficulty breathing, pain, emotional stress, medications, and disturbances in the healthcare setting. As a result of long work schedules and rotations, healthcare providers are prone to sleep deprivation. Hospitalization makes patients prone to sleep deprivation caused by environmental noises and interruptions for care. Parasomnias are sleep problems that are more common in children. These include sleepwalking, night terrors, nightmares, bedwetting, body rocking, and tooth grinding. When adults have these problems, it often indicates more serious disorders. Please review Box 43-3, Sleep Deprivation Symptoms, as a supplement to this PowerPoint. Time for a quick quiz. During rounds on the night shift, you note that a patient stops breathing for 1 to 2 minutes several times during the shift. This condition is known as A. Cataplexy, B. Insomnia, C. Narcolepsy, or D. Sleep apnea. The answer is D. Sleep apnea is a disorder characterized by lack of airflow through the nose and mouth for periods of 10 seconds or longer during sleep. Sleep and rest. Rest does not indicate inactivity. When rested, people experience feelings of rejuvenation, feeling refreshed, and able to carry out of activities of daily living. Illness and unfamiliar healthcare routines affect the usual rest and sleep patterns of hospitalized patients. It will be important to allow patients periods of rest. Nurses frequently care for patients who are on bed rest to reduce physical and psychological demands on the body in a variety of healthcare settings. However, these people do not necessarily feel rested. Some still have emotional worries that prevent complete relaxation. You must always be aware of a patient's need for rest. Lack of rest for long periods causes illness or worsening of existing illness. Normal sleep requirements and patterns. Sleep duration and quality will differ across the lifespan. In adolescence, shortened sleep time often results in excessive daytime sleepiness, which frequently leads to reduced performance in school, vulnerability to accidents, behavior and mood problems, and increased use of alcohol. Pregnancy increases the need for sleep and rest. However, a majority of pregnant women describe variations in sleep habits. Estrogen has been shown to decrease REM sleep. In middle age, the amount of stage 4 sleep begins to fall. This is a decline that will continue with advancing age. Older adults experience weakening, desynchronized circadian rhythms that alter the sleep-wake cycle. Episodes of REM sleep tend to shorten. There is a progressive decrease in stages 3 and 4 non-REM sleep, and some older adults have almost no stage 4 or deep sleep. Please familiarize yourself with the various sleep requirements as listed on this slide. Time for a quick quiz. A 4-year-old pediatric patient resists going to sleep. To assist this patient, the best action to take would be A. Adding a daytime nap, B. Allowing the child to sleep longer in the morning, C. Maintaining the child's home sleep routine, or D. Offering the child a bedtime snack. The answer is C. Maintaining the child's home sleep routine. Factors influencing sleep. A number of factors affect the quality and quantity of sleep. Often, several factors of these contribute to a sleep disorder. Physiological, psychological, and environmental factors inhibit sleep. Sleepiness, insomnia, and fatigue often result as a direct effect of commonly prescribed medications such as hypnotics, diuretics, narcotics, antidepressants, alcohol, caffeine, beta blockers, and anticonvulsants. Emotional stress causes a person to be tense, and often leads to frustration when sleep does not occur. Stress also causes a person to try too hard to fall asleep, to awaken frequently during the sleep cycle, or to oversleep. Continued stress causes poor sleep habits. Older patients frequently experience losses that lead to emotional stress such as retirement, physical impairment, or the death of a loved one. Older adults and other individuals who experience depressive mood problems experience delays in falling asleep, earlier appearance of REM sleep, frequent or early awakening, feelings of sleeping poorly, and daytime sleepiness. Good ventilation is essential for restful sleep. The size, firmness, and position of the bed affect the quality of sleep. If a person usually sleeps with another individual, sleeping alone often causes wakefulness. On the other hand, sleeping with a restless or snoring bed partner disrupts sleep. Following good eating habits is important for proper sleep. Weight loss or gain influences sleep patterns. Weight gain contributes to OSA because of increased size of the soft tissue structures in the upper airway. Please review box 43-4, Drugs and Their Effects on Sleep, as a supplement to this PowerPoint. Time for another quick quiz. A patient suffers from sleep pattern disturbance. To promote adequate sleep, the most important nursing intervention is A. Administering a sleep aid, B. Synchronizing the medication, treatment, and vital signs schedule, C. Encouraging the patient to exercise immediately before sleep, or D. Discussing with the patient the benefits of beginning a long-term nighttime medication regimen. The answer is B. Synchronize the medication, treatment and vital signs schedule. Case study: Anna is a 23-year-old nursing student assigned to the nursing home for her second semester in nursing school. She has had experience in nursing homes, having worked in one center as a nurse assistant during the last 2 summers. Anna's assignment is to care for Mr. Murphy over the next 4 weeks. What are some factors that Anna should consider when planning care for Mr. Murphy? Successful critical thinking requires a synthesis of knowledge, including information gathered from patients, experience, critical thinking attitudes, and intellectual and professional standards. Clinical judgments require you to anticipate the information necessary, analyze the data, and make decisions regarding patient care. You adapt critical thinking to the changing needs of the patient. Personal experience with a sleep problem and experience with patients prepares you to know effective forms of sleep therapies. You use critical thinking attitudes such as perseverance, confidence, and discipline to complete a comprehensive assessment and develop a plan of care to provide successful management of the sleep problem. Professional standards, such as the nursing scope and standards of practice, clinical guidelines for the treatment of primary insomnia, and excessive sleepiness in evidence-based geriatrics nursing protocols for best practice, provide valuable guidelines to assess and addresses the needs of patients with sleep disorders. Case study continued. As Anna prepares to conduct an assessment of Mr. Murphy, she knows it is important to consider how sleep is altered in older adults. Because they typically have less deep sleep and more awakenings, it will be important to consider what factors in the nursing home disrupt sleep. Anna plans to include Mrs. Murphy in the assessment to learn more about her perceptions of changes in Mr. Murphy's behavior. Anna plans to talk with Mr. Murphy more than once to gather the necessary information and to keep her patient from becoming fatigued. Anna should also consider factors that affect sleep in the nursing home, such as physical illness, dementia, and depression. Anna decides to ask the following assessment questions of Mr. Murphy. Please describe the nature of your sleep problem. Do you awaken during the night? Can you rate the quality of last night's sleep? Please describe your usual bedtime routine. And, are you having any trouble that is contributing to your sleep problem? She also assesses Mr. Murphy for signs of sleep problems. Here are Mr. Murphy's responses. Mr. Murphy says that it's probably taking him about an hour to get to sleep. On whether he awakens during the night, Mr. Murphy replies, "Are you kidding? No one can sleep around here, something is always going on." Mr. Murphy estimates he got about 4 hours of sleep the night before. He estimates it is nearly the worst night of sleep he has ever had. At home, Mr. Murphy usually slept from about 10 p.m. to 6:30 a.m. He says he rarely had trouble getting to sleep at home, and his wife says that listening to music helped him relax. Mr. Murphy says that he is having some pain from the osteoarthritis, and he is having trouble changing position and getting comfortable. Mr. Murphy yawns frequently and shifts position in his wheelchair frequently. Assess patients' sleep patterns by using a nursing history to gather information about factors that usually influence sleep. Sleep is a subjective experience. Only the patient is able to report whether or not it is sufficient and restful. If the patient is satisfied with the quantity and quality of sleep received, you consider it normal, and the nursing history is brief. But, if a patient admits to or suspects a sleep problem, you need a detailed history and assessment. If a patient has an obvious sleep problem, consider asking if his or her sleep partner can be approached for further assessment data. A poor night's sleep for a patient often starts a vicious cycle of anticipatory anxiety. Usually patients are the best resource for describing sleep problems and how they represent a change from their usual sleep and waking patterns. In addition, bed partners are able to provide information about patients' sleep patterns that helps reveal the nature of certain sleep disorders. When caring for children, seek information about sleep patterns from parents or guardians because they are usually a reliable source of information. Two effective subjective measures of sleep are the Epworth Sleepiness Scale and the Pittsburgh Sleep Quality Index. Another brief subjective method to assess sleep is a numeric scale with a 0 to 10 sleep rating. When suspecting a sleep problem, assess the quality and characteristics of sleep in greater depth by asking the patient to describe the problem. This includes recent changes in sleep pattern, sleep symptoms experienced during waking hours, use of sleep and other prescribed or over-the-counter medications, diet and intake of substances such as caffeine or alcohol that influence sleep, and recent life events that have affected the patient's mental and emotional status. If a patient's sleep is adequate, assess his or her usual bedtime, normal bedtime ritual, preferred environment for sleeping, and usual preferred rising time. When a patient has a sleep problem, conduct a complete sleep history. Diagnosing sleep problems depends on identifying factors that impair sleep. A general description of the problem followed by more focused questions usually reveals specific characteristics that are useful in planning therapies. To begin, you need to understand the nature of the sleep problem, its signs and symptoms, its onset and duration, its severity, any predisposing factors or causes, and the overall effect on the patient. Proper questioning helps to determine the type of sleep disturbance and the nature of the problem. As an adjunct to the sleep history, have the patient and bed partner keep a sleep-wake log for 1 to 4 weeks. Ask the following questions to determine a patient's sleep pattern. 1. What time do you usually get in bed each night? 2. How much time does it usually take to fall asleep? Do you do anything special to help you fall asleep? 3. How many times do you awaken during the night? 4. What time do you typically wake up in the morning? And 5. On average, how many hours do you sleep each night? Patients with sleep problems frequently show patterns drastically different from their usual one, or sometimes the change is relatively minor. Please review Box 43-5, Nursing Assessment Questions, and Box 43-6, Questions to Ask to Assess for Specific Sleep Disorders, as a supplement to this PowerPoint. Determine whether the patient has any pre-existing health problems that interfere with sleep. A history of psychiatric problems also makes a difference. If the patient has recently had surgery, expect him or her to experience some sleep disturbance. Patients usually awaken frequently during the first night after surgery and receive little deep or REM sleep. Depending on the type of surgery, it takes several days to months for a normal sleep cycle to return. In your assessment, learn if the patient is experiencing any changes in lifestyle that disrupt sleep. A person's occupation often offers a clue to the nature of the sleep problem. A patient's emotions and mental status affect the ability to sleep. When a sleep disturbance is related to an emotional problem, the key is to treat the primary problem. Its resolution often improves sleep. Ask patients what they do to prepare for sleep. Pay special attention to a child's bedtime rituals. Some young children need a special blanket or stuffed animal when going to sleep. Observe for behaviors such as irritability, disorientation, frequent yawning, and slurred speech. If sleep deprivation has lasted a long time, psychotic behavior such as delusions and paranoia sometimes develop. Please review Figure 43-3, Critical Thinking Model for Sleep Assessment, as a supplement to this PowerPoint. Case study continued. Anna has learned that Mr. Murphy's osteoarthritis pain is a contributing factor to the sleep disturbances. His immobility from the stroke adds discomfort. Anna determines that environmental stimuli are also disrupting his sleep. Anna evaluates whether a roommate or visitors, The presence of electronic equipment at his bedside, and the likelihood of noise coming from an outside hallway are factors. Anna also plans to assess Mr. Murphy's medications carefully to determine whether any drugs are adding to his sleep alteration. What nursing diagnosis do you anticipate? Nursing diagnosis. Review your assessment data, looking for clusters of data that include defining characteristics for a sleep pattern disturbance or other health problem. If you identify a sleep problem, specify the condition, such as insomnia or sleep deprivation. By specifying the sleep disturbance diagnosis, you are able to design more effective interventions. Assessment also identifies the related factor or probable cause of a sleep disturbance, such as a noisy environment or a high intake of caffeinated beverages in the evening. Listed on this slide are various possible nursing diagnoses related to sleep pattern disturbances. Please review box 43-7, Nursing Diagnostic Process, Insomnia, as a supplement to this PowerPoint. Case study continued, Nursing Diagnosis, Insomnia related to excessive environmental stimuli. The goal for Mr. Murphy is that he will attain a sense of restfulness after sleep, in 1 month. Some expected outcomes include, Mr. Murphy will have fewer than 2 self-reported awakenings during the night. Mr. Murphy will report being able to fall asleep within 30 minutes of going to bed, and Mr. Murphy will sleep an average of 7 hours a night. Professional standards are especially important to consider in developing a care plan. Nurses should be aware that quite frequently sleep disturbances are the result of other health problems. As you plan care for a patient with sleep disturbances, creation of a concept map is another method for developing holistic patient-centered care. When developing goals and outcomes, it is important for a nurse and patient to collaborate with other healthcare professionals. Patients are a helpful resource in determining which interventions hold priority. When patients have chronic sleep problems, the initial referral for a patient is often to a comprehensive sleep center for assessment of the problem. The nature of the sleep disturbance then determines whether referrals to additional healthcare providers are necessary. Please review Figure 43-4, Critical Thinking Model for Sleep Planning, and Figure 43-5, Concept Map for Julie Arnold, as a supplement to this PowerPoint. Nursing interventions designed to improve the quality of a person's rest and sleep are largely focused on health promotion. Patients need adequate sleep and rest to maintain active and productive lifestyles. During times of illness, rest and sleep promotion are important for recovery. In community health and home settings, help patients develop behaviors conducive to rest and relaxation. Patients benefit most from instructions based on information about their homes and lifestyles, such as which types of activities promote sleep in a night shift worker, or how to make the home environment more conducive to sleep. They will likely apply information that is useful and valued. All patients require a sleeping environment with a comfortable room temperature and proper ventilation, minimal sources of noise, a comfortable bed, and proper lighting. Eliminate distracting noise so the bedroom is as quiet as possible. In the home, the television, telephone, or the intermittent chiming of a clock often disrupts a patient's sleep. Patients vary in regard to the amount of light that they prefer at night. Please review Box 43-8, Focus on Older Adults, Promoting Sleep, and Box 43-9, Patient Teaching, Sleep Hygiene Habits as a supplement to this PowerPoint. Bedtime routines relax patients in preparation for sleep. It is always important for persons to go to sleep when they feel fatigued or sleepy. A bedtime routine used consistently helps young children avoid delaying sleep. Adults need to avoid excessive mental stimulation just before bedtime. For any patient prone to confusion or falls, safety is critical, such as use of a night light, bed set lower to the floor, and removal of clutter. Sleepwalkers are unaware of their surroundings and are slow to react, increasing the risk of falls. Do not startle sleepwalkers, but instead gently awaken them and lead them back to bed. Infants' beds need to be safe. To reduce the chance of suffocation, do not place pillows, stuffed toys, or the ends of loose blankets in cribs. Loose-fitting plastic mattress covers are dangerous because infants pull them over their faces and suffocate. Parents need to place an infant on his or her back to prevent suffocation. People fall asleep only after feeling comfortable and relaxed. In the home, it helps to encourage patients to stay physically active during the day so they are more likely to sleep at night. Increasing daytime activity lessens problems with falling asleep. The inability to sleep because of emotional stress also makes a person feel irritable and tense. When patients are emotionally upset, encourage them to try not to force sleep. Otherwise, insomnia frequently develops, and soon bedtime is associated with the inability to relax. It is common for preschoolers to have bedtime fears, awaken during the night, or have nightmares. Cultural tradition causes families to approach sleep practices differently. Some people enjoy bedtime snacks, whereas others cannot sleep after eating. A dairy product such as warm milk or cocoa that contains L-tryptophan is often helpful in promoting sleep. A full meal before bedtime often causes gastrointestinal upset and interferes with the ability to fall asleep. Warn patients against drinking or eating foods with caffeine before bedtime. Melatonin is a neurohormone produced in the brain that helps control circadian rhythms and promote sleep. It is a popular nutritional supplement that is found to be helpful in improving sleep efficiency and decreasing nighttime awakenings. The recommended dose is 0.3 to 1 mg taken 2 hours before bedtime. Several other herbal products assist in sleep. Valerian is effective in mild insomnia and restless leg syndrome. Valerian affects the release of neurotransmitters and produces very mild sedation. Kava helps promote sleep in patients with anxiety. It should be used cautiously because of its potential toxic effects on the liver. Chamomile, a herbal tea, has a mild sedative effect that may be beneficial in promoting sleep. The use of non-prescription sleeping medications is not advisable. Patients need to learn the risks of such drugs. Over the long term, these drugs lead to further sleep disruption, even when they initially seemed effective. Please review Box 43-10, Cultural Aspects of Care, Co-Sleeping, as a supplement to this PowerPoint. In a hospital, the nurse controls the environment in several ways. When planning interventions to promote sleep, consider the usual characteristics of the patient's home environment and normal lifestyle. Patients in acute care settings have their normal rest and sleep routine disrupted, which generally leads to sleep problems. In this setting, nursing interventions focus on controlling factors in the environment that disrupt sleep, relieving physiological or psychological disruptions to sleep, and providing for uninterrupted rest and sleep periods for the patient. In a hospital or extended care setting, it is difficult to provide patients with the time needed to rest and sleep. The most effective treatment for sleep disturbances is elimination or correction of factors that disrupt the sleep pattern. When the patient's condition demands more frequent monitoring, plan activities to allow extended rest periods. Patients with OSA are at risk for complications while in the hospital. Surgery and anesthesia disrupt normal sleep patterns. After surgery, patients reach deep levels of REM sleep. This deep sleep causes muscle relaxation that leads to OSA. Patients with OSA who are given opioid analgesics after surgery have an increased risk of developing airway obstruction because the medications suppress normal arousal mechanisms. Recommend lifestyle changes to patients with OSA that include sleep hygiene, alcohol moderation, smoking cessation, and a weight loss program. One of the most effective therapies is use of a nasal continuous positive airway pressure device at night, which requires a patient to wear a mask over the nose. A mask delivers room air at a high pressure. Patients who are hospitalized for extensive diagnostic testing often have difficulty resting or sleeping because of uncertainty about the state of their health. Giving patients control over their health care minimizes uncertainty and anxiety. Providing for personal hygiene improves the patient's sense of comfort. As a nurse, you will learn to control symptoms of physical illness that disrupt sleep. The liberal use of drugs to manage insomnia is quite common in American culture. Medications that induce sleep are called hypnotics. Sedatives are medications that produce a calming or soothing effect. Benzodiazepines and benzodiazepine-like drugs are common classifications of drugs used to treat sleep problems. Regular use of any sleep medication often leads to tolerance and withdrawal. Shown are figures 43-6, positioning patient for sleep, and 43-7, mask suitable for continuous positive airway pressure. Please review box 43-11, evidence-based practice, sleep hygiene in hospitalized patients, and box 43-12, control of noise in the hospital, as a supplement to this PowerPoint. Case study continued. Anna asked Mr. Murphy to use a rating scale for the quality of his sleep at the end of each week. After 1 week, Mr. Murphy rates his night's sleep at a 6 out of 10. After 2 weeks, an 8 out of 10. Anna asked Mrs. Murphy to evaluate her perceptions of Mr. Murphy's level of fatigue. She says he is more alert, awake, and talkative during her visits. Anna asked Mr. Murphy at the end of 4 weeks to keep a record for a week of the length of time he estimates he is sleeping. At the end of the month, Mr. Murphy is falling asleep within 30 minutes of going to bed. He gets up 2 to 3 times a night, and he estimates that he gets 6 hours of sleep a night. With regard to problems with sleep, the patient is the source for evaluating outcomes. Each patient has a unique need for sleep and rest. The patient is the only one who knows if sleep problems are improved and which interventions or therapies are most successful in promoting sleep. If a nurse has successfully developed a good relationship with the patient and a therapeutic plan of care, subtle behaviors often indicate the level of the patient's satisfaction. Note the absence of signs of sleep problems such as lethargy or frequent yawning or position changes in the patient. You are effective in promoting rest and sleep if the patient's goals and expectations are met. Please review Figure 43-8, Critical Thinking Model for Sleep Evaluation, as a supplement to this PowerPoint.